Years ago in dentistry, we couldn't glue things, but now we can. And so adhesive dentistry and some of the other products are a great help for us. So where you crack your tooth, we can now put on a filling that glues onto the tooth. And we can get fantastic results and colours without removing much of the tooth at all. But back in the day, we take a lot of the tooth away in order to get a nice aesthetic result, and this was called a crown. But we try to avoid these a bit more now. The reason being, it's so tooth destructive, as you can see, and often the teeth that are crowned, well, 1 in 3, the nerve of the tooth, as we describe it, becomes infected, and then you need a root filling, and then you probably need another crown, but you definitely end up with less tooth tissue. With the recent advances in digital imaging, both with radiographs and also with photographs, we're now able to monitor your condition a lot more closely. And there's a variety of equipment and materials that are to avoid actually taking away any of your tooth tissue. And we can paint the teeth with some products, and that helps stop, or what we say is arrest, the decay. 40 years ago, if there was a problem with a tooth, we'd take out all the old filling and start from scratch. But we don't have to do that anymore. We can repair them using the materials that glue on, and also sometimes we can just put grooves in the existing filling and we can gradually add bits on. And these repairs can last over 10 years. And some bits that are chipped off, as long as you keep them clean, won't progress. So it may be more difficult to treat them than to leave them alone. And there is a balance. In the end, you need to do something, otherwise you might lose the one little bit of tooth that may hold a restoration in. Most people have heard of veneers, and so this lady wasn't happy with the appearance of this tooth, and so rather than do a crown, which I'd done previously on an adjacent tooth, we just did a veneer. There are lots of ways of doing it. You can just use filling material, or this one used a combination of filling material and porcelain. It was made on a machine and it just glues in, and so it only takes one visit and you don't need any anaesthetic either. Some of the materials that were used for repairs can be added to and topped up, and it's very rare to get decay underneath them. So when the time comes, even though in this case rather late, you can just clean out the filling and with a slight modification take a picture and then glue in a crown. And so while it is a crown, it is also minimally invasive because you've hung on to as much tooth tissue as you possibly can. And if you've got a single missing tooth, we can glue in a false tooth onto the adjacent sound tooth, and we've been doing this for over 30 years. Traditionally they had a metal framework, and you may have a white framework now, and the ones that you can see here were placed over 30 years ago. We're not quite sure if implants will last that long, and also you don't need an anaesthetic for this procedure. MID works if you see your dentist regularly, and often I think it's best budgeted through a plan.